A new study shows that the popular weight loss drug Wegovy has more benefits than just weight loss. It can help with risks of stroke and heart attacks. The study was paid for by the company and published in the New England Journal of Medicine. This new study was done by the Cleveland Clinic. And joining us now is the study's lead author, Dr. Michael Linkoff, Vice Chair for Research of the Department of Cardiovascular Medicine at the Cleveland Clinic. Thank you so much for making time for us today.
Thank you for your interest. I'm happy to speak to you.
Okay, so it sounds like there are added benefits to this weight loss drug. It decreases the risk of serious heart problems by 20%. That's pretty big. Can you tell us more about the findings?
Sure. So this class of drugs, but this in particular, has been known in patients with diabetes to reduce heart risk. But patients with overweight or obesity have increased risk. So far there has been no drug, no trial, no lifestyle management that has been shown to reduce the cardiovascular risk. So while we routinely treat patients with blood pressure, high blood pressure, with their lipids, with diabetes, with medications that we know will reduce risk, we've had no way to reduce the risk associated with overweight and obesity. So this trial randomized 17,000 patients who had overweight and obesity and had previously had a cardiovascular event. They had had a heart attack or a stroke, and then randomized them to receive Wegovy or a placebo that matched. We were blinded. Nobody knew throughout the trial which patients were on Wegovy, which were on placebo. And importantly, these patients were not being, there wasn't a lack of treatment. They were all receiving good treatment for their cholesterol, for their blood pressure. They were well controlled, but this was added to that standard of care. What we found among these 17,000 patients who we followed for around 3.5 years on average was that the risk of a composite endpoint, which was a combination of either death from cardiovascular causes or heart attack or stroke, was reduced by 20%. The heart attack part of that was reduced by 28%, and on all-cause death from any reason was reduced by about 19%. And somewhat less significant effects on the stroke risk. So this was a big impact, and now is really the first drug or management strategy that's ever been shown in a rigorous study to reduce the risks of heart problems associated with overweight or obesity.
Yeah, Dr. Linkoff, does this mean that doctors may change how they treat heart patients moving forward?
I certainly think it will. It's really a standard of care to treat the other risk factors that we know we can modify. We could, hypertension, high cholesterol, diabetes. So now overweight and obesity is a new pathway. It's emerged as, what we call a modifiable risk factor. It's not just something we notice, but we can't do anything about it. And it's really now, it's on the part of practitioners who care for patients with overweight and obesity, if they have heart disease, that we should be treating this pathway as well.
We should mention that this is not a cheap drug. It costs about $1,300 a month, and it's not for everybody. But could this mean that people who don't have weight problems may end up taking it, like people with heart conditions?
Well, that's very interesting. And the mechanisms are not completely worked out about how it benefits. It's probably multiple effects. Some of it certainly is weight loss. And the process of weight loss and the changes in the fat cells that are inflammatory and cause clotting, et cetera. But there are multiple other effects. Now, whether or not that would work in patients who don't have overweight or obesity or who don't have diabetes is unknown. It's really not been tested. Certainly, if they don't have the contributors, the metabolic contributors of overweight and obesity leading to their increased risk, they may or may not have benefit. I think that the focus is going to be really on identifying the patients who are at risk. In our study, it was patients who already had a heart problem, but patients who have other risk factors that may be at heart problems, may be in the future eligible as well. But there's certainly enough patients who have heart disease and overweight and obesity that to benefit. I think it'll be a bit away before patients who don't have overweight obesity would be thought to benefit.
And Dr. Linkoff, again, we want to mention that this study was paid for by the makers of the drug, but it just seems like it's all positive news in this study. It helps people lose weight and reduces the risk of heart problems. So are there any drawbacks to this drug?
So there are known side effects, and this was by far the largest trial and the longest trial. So we really got a very reassuring, very large database experience now that was very reassuring. We found no new adverse events. So the adverse events are, the main side effect is GI. So patients can have diarrhea or nausea or constipation. This is usually in the first couple of months as they start the drug and work the dose up. But we had no serious adverse events. and there's also an increase in gallstones. We didn't have any pancreatitis, which can be a very concerning illness. We didn't have major adverse events. So that was very reassuring. The other factor with this is that you need to keep taking it, at least as far as we know. In the studies that have been done so far, if patients stop after a year, they regain some of their weight. We don't know what would happen with the cardiovascular events, but we've got to think about it like blood pressure and like diabetes and like cholesterol. It's not
Right.
going to go away. Obesity and overweight is a chronic metabolic disease.